Do women have the right to make decisions about their fertility without political interference? An IUD is one of the most effective birth control methods out there. It's small, T-shaped, and can last for years. But for some women, getting it inserted can be a painful experience. Historian Evan Elizabeth Hart has explained that the small pinch they warn you about before an IUD insertion is actually the literal stapling of your cervix without anesthesia. Hart, who specialises in the history of women's health activism at Missouri Western State University, doesn't shy away from calling it what it is: medical gaslighting. Oh, it's so gross.
I know.
I'm so sorry. I even practiced it. And it's just so gross. It makes me really clench all the way through my body. So, named after a 19th century French gynecologist, Dr. Samuel Pozzi, these forceps, or tenaculum, were inspired by an American bullet extractor used during the Civil War. Used in gynecological procedures for over a century, these forceps grip the cervix, often without anesthesia, aiding to the discomfort of women. What does this look like? I'm holding a balloon.
That's the cervix.
No, it isn't. Samuel Pozzi wasn't just a surgeon. A Belle Epoque celebrity in Paris named him Love Doctor for his flirtations and flamboyant lifestyle. But his legacy in gynecology goes a lot deeper than his affairs. The cervix is packed with nerves, and yet instruments like the tenaculum, designed in the 1800s, are still being used as if pain wasn't part of the equation. Despite Pozzi's good intentions to modernise women's healthcare, the tool he invented still haunts us today. Photographer Lindsay Beale, who documents old medical instruments, says the Pozzi forceps belong in a museum, not a doctor's office.
Small world, Dr. Jones. Too small for two of us. That belongs in a museum. So do you.
Aw, you don't mean that.
Do you know what, though? That article was amazing for igniting my sympathy for Pozzi. I started it hating his guts, invented by Pozzi. Yeah. And then it turned out he tried so hard to make women's lives easier. He just had this strange assumption that the cervix had no nerve endings. Who knows what he based that on? In recent years, women have been speaking out about the pain, and doctors are finally starting to listen. Devices like the Carvix, a suction-based tool designed to minimise discomfort during the procedure, offer a gentler alternative. Pain relief options, new technologies, and awareness are all helping to change the narrative. Because no one should have to endure just a pinch when we know there's a better way. By listening to women's experiences and advancing medical practices, we can make strides in creating a medical system that respects women's health. Maybe it's time to retire Pozzi's forceps for good. One of the most common but often unspoken procedures in childbirth is the episiotomy. A surgical incision made in the perineum to enlarge the vaginal opening during delivery. For decades, episiotomies were routine, thought to prevent tearing and ease childbirth. But here's the catch. Many of them weren't necessary, and like other gynecological interventions, they were often done without informed consent. Today, the World Health Organization advises against routine episiotomies. But like many interventions in women's reproductive health, this highlights a much larger issue: the lack of bodily autonomy in medical decision-making.
My mom had that.
Really?
Because of me.
I've never heard of one before, but My mum never mentioned it.
It's as if I was to come up with a surgery, and because I know nothing, I'd be like, oh, just make it bigger.
Yeah, make the hole bigger. This fits into a wider issue, the gender pain gap, the well-documented phenomenon where women's pain is less likely to be taken seriously by medical professionals. Whether it's during IUD insertions, cervical exams, or childbirth procedures, many women's voices are drowned out by outdated practices and paternalistic attitudes. The solution? Informed consent. That's it. Making sure women know their options and giving them a say in what happens to their bodies during these intimate procedures. Episiotomies and IUD insertions are part of a much larger conversation about women's rights to control their bodies and make informed decisions about their reproductive health. In 2024, the fight for reproductive rights is more urgent than ever. Around the world, governments are attempting to restrict access to contraception, abortion, and fertility treatments. The question at its core is, do women have the right to make decisions about their fertility without political interference? Women have been battling for control over our bodies for centuries, challenging dismissive doctors, advocating for contraception in the 1960s, and now demanding the right to fertility treatments and reproductive health care. These battles are all connected. Whether it's about pain relief, birth control, or fertility rights, every woman deserves to have her choices honoured. So the next generation of women won't just inherit these tools, but also the freedom to do what's best for their bodies.